here and the upper ends of the radius and ulna over here. So that is not the main concern over here. The main center of X-ray is nothing but the elbow joint over here. The center of the X-ray is concerned with the elbow joint over here, right? So this is the lower part of the shaft of the humerus, and these are the upper parts of the radius and ulna. And again you can see. So what might be this part of the bone? This part of the bone? Medial and lateral supracondylar. Among these two, which one is the medial epicondylar and which one is the lateral epicondylar?
Which is more prominent?
More prominent. This one medial epicondylar.
How can you say it is medial epicondylar?
More prominent.
More prominent.
More prominent.
More prominent than any other ulna. So you can see that auricular process, or it might be coronoid auricular process over here. So that is lodging onto the auricular fossa over here. Based on that also you can see that this is the medial side or medial epicondyle over here. And this is the radial head, you can see that clearly. And this is the less prominent lateral epicondyle over here. Okay. And you can't see the trochlea or the capitulum over here because they are getting overlapped because of the extension. Okay. So if there is any fracture over here, there will be disruption of the surface over here. Getting it? It's not. These are normal X-rays what you are seeing over here. Okay. Right. Okay. So this is the antero-posterior view. That's why you could able to see the auricular fossa over here and the auricular process over here and the ulna and radius side by side. Could you able to understand? Okay. Towards that side will be the radius and towards this side is the ulna. And you can see absolutely two epicondyles over here and you can see the auricular fossa over here. So that will be possible only in the antero-posterior direction. Isn't it, Donald? In the antero-posterior direction, you can see the two epicondyles and the radius and ulna over here. If you take disease, which view it might be? Laterally. That's why you can see the lower half of the shaft of the humerus over here, but you can't see any auricular fossa or trochlea or capitulum over here. They're getting overlapped over here. Okay. And you can clearly see this is the auricular process. And this is the coronoid process over here, and this is the rest of the shaft of the ulna, and this is the radius, and this is the neck of the radius over here, and this is the shaft of the radius over here. Okay, so here they are side by side and here they are overlapping with each other. Could you able to understand? Here they are side by side, and you can see the interosseous membrane space over here. Okay, and here also you can see, but there is an overlap. The part of the radius is missing over here. Is it not? Yeah. So because the coronoid process is overlapping the radius, so if you keep the arm in this manner, the coronoid process will be obstructing the radial head over here. Okay, that will not happen in antero-posterior direction, right? Radius and ulna will appear side by side in antero-posterior direction, but that will get overlapped. Part of the radius will be overlapped by the ulna in case of lateral in this manner. Could you understand? So how to describe this X-ray? Somebody? How to describe this X-ray?
This is the
Lateral right.
How to describe this X-ray?
This is the plane.
How to describe this X-ray? No. The next one.
Right hand.
The middle one. How to describe this X-ray? No. The next one. Antero-posterior lateral view of right elbow joint over here. Okay. We are not concerned with the arm or with the forearm. Okay. Only with the elbow joint. Got it? Very good. Sit down. Differentiate antero-posterior, posterior view. If you take the posterior view also, it will be appearing the same manner. So we are not concerned over the structures what we are seeing on the posterior aspect or anterior aspect. The X-rays will be passing through and through. Only few structures will be seen. Here we can't see any coronoid fossa or radial fossa over here. Okay. And here we can't see any, for example, ulnar tuberosity. We can't see the ulnar tuberosity over here. Only part of the ulna can be seen because there is an overlap because it is passing through and through. Getting it? If you flash a light on yourself, the shadow will not be showing the anterior or posterior direction, right? So in the same manner, the X-rays will be displaying only the structure which is on the outlines over here, which are having the outlines over here, and that the major structures over here, not the microscopic or minute structures over there.
So we cannot differentiate about anterior and posterior.
No, we can't differentiate. Clinical significance of that. Okay, for example. So have you ever seen 300 movie? 300 movie have you seen? 300 warriors, right? So the 300 warriors will be fighting with some thousands of people over there. So they will be focusing on throwing the arrows. Okay, right? Throwing the arrows. The arrow might be striking the individual from anterior to posterior direction or posterior to anterior direction. But the individual will be dead. Isn't it? In the same manner, We are concerned only with the fractures over here, not about the surface of the bone, not about the structures which are present on the bone.
So actually, I asking about that. The anterior posterior view and the posterior view
Yeah.
are two different.
Yeah.
processes.
Yeah.
Then when we apply the anterior posterior and the posterior.
That's what I'm saying, right? For example, okay, I'll tell you in this manner. In case of thorax, we'll be taking postero anterior view. Anybody? Okay, somebody switch on the flash right? Okay. We just focus over here. Thank you. So focus over here, everybody. Okay. So difference between anteroposterior and posterior anterior in case of thorax. Okay. So in case of superior extremity and inferior extremity, so both anteroposterior and posterior anterior views will be the same. Okay. Now we are seeing the posterior anterior view and anteroposterior. What is the significance of it? Okay. If you take the X-ray of the thorax in anteroposterior view or posterior anterior view, you'll be seeing the ribs. Is it not? You'll be seeing the ribs in the anteroposterior or posterior anterior view. But for example, when it comes to the heart, for example, my heart is situated more towards the anterior aspect in case of thoracic cavity. Okay. So thoracic cavity is in this manner. This is the anterior direction. This is the posterior direction. The heart will be more towards the anterior direction. You can feel the heart pulsation on the anterior aspect, not on the posterior aspect, right? So heart is situated more towards the anterior aspect. Okay. So for example, this is the anterior aspect and this is the posterior aspect, for example. Okay. Now I am doing the postero anterior view X-ray. PAV, postero anterior, from the posterior direction towards the anterior direction. And the heart is situated towards the anterior aspect, right? Isn't it? Okay. This wall is the anterior direction. Towards your side is the posterior direction. Okay. My heart appears in this manner. Fist is the size of the heart. Is it done? Okay. So my heart appears normal in size in case of postero anterior view because the rays will be passing all the way away from the heart over here. Okay. So then you can get the normal surface of the heart over here. That means normal shape of the heart over here. Okay. For example, I have reversed it. For example, this is the anterior direction and this is the posterior direction. For example, look at the size of the heart over here when I am changing the direction. Okay. So now I am taking from anterior to posterior direction. Okay. My heart will be on the anterior aspect and now the X-ray plate is on the posterior aspect. How my heart is seeing over here? Very large. So that is the difference. Okay. So to take the heart X-ray in case of thorax, you have to do it on postero anterior to get the normal size of the heart. But if you take it on anteroposterior direction, because the heart is very much close to the X-rays will be diverged around the heart. So the heart appears wider. I mean that it appears to be abnormally big. Getting it out? So the view of the X-ray changes the structures over here. But in case of upper arm and lower arm, whatever the side you take, it will be of the same size. There is no change of anything. Because X-rays will be over here, plate will be over here. In between those two, your hand will be there. But the heart position will be changing. That changes the size in the X-ray plate based on the X-rays focused over here. Got it? Right? Yeah. Thank you. So you understood or not, right? Yes, right? Okay, that's good. Okay. So here there is no heart, no change of structures, only the muscles and the blood vessels will be on the anterior and posterior direction, but the bones will be in the midst. Is it not? So there is no change of size in case of bones, in case of anteroposterior view or posterior anterior. You can take the posterior anterior view also. The appearance will be the same, but the patient, based on the patient's position, you have to take. Got it? Right? That's why most of the patients will be lying supine on the bed in case of casualty in the emergency room. So you'll be focusing the X-rays all the way from anterior to posterior direction. Not you'll be bending the patient and you'll be taking from posterior to anterior direction. Is it or not? You are the good doctors, right? Okay, you'll not be hurting the patient further, right? Okay. So anterior, posterior, and posterior anterior view in case of superior extremity and inferior extremity doesn't make any change, but that will make a change in case of thorax. Okay, right? So it's a plain X-ray, anterior posterior view, and lateral view of right elbow joint.
Elbow joint. Yes.
So this R represents the right side of both the things. Both the things over here is represented by R over here. 15 is the number of the X-ray plate. Nothing, don't bother about that. Okay. And then followed by, how can you describe this X-ray?
First of all, this is
It's a plain X-ray.
plain X-ray.
Right forearm.
Plain X-ray. On the right forearm.
Right forearm. Anterior posterior.
How can you say it is anterior posterior view?
Because the bones are not overlapped.
Because again you can see here the radius and ulna side by side over here.
No overlap.
And you can see this is the radial tuberosity over here clearly.
Yes.
And you can see the radial styloid process over here. And here will be the ulnar styloid process over here. Right? What? Okay, fine. So again, this is a plain X-ray, anteroposterior view. Okay, and right forearm over here. Okay, and any area, one joint will be above and one joint will be below in case of superior extremity and inferior extremities over here. Okay. So again, you can see this is the anteroposterior view. Based on that, you can say that this is the medial epicondyle, this is the lateral epicondyle over here, and this is the olecranon fossa over here. Okay. And this is the most probably the coronoid process, and this is the head of the radius and neck of the radius and radial tuberosity. And these are the shafts of the radius and ulna. You can see clearly without a much overlapping over here, right? And you can see the wrist joint also very clearly over here. And what are these bones over here?
Carpal one.
Absolutely, carpal bones. And because this is the radius, these two bones are
Scaphoid and lunate. Scaphoid and lunate.
This is the styloid process on the.
This is scaphoid. Scaphoid and the lunate. Pisiform. Trapezium. Trapezoid.
I'll be showing with a bigger view in the next slide. Okay. 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 And then this one is the same X-ray, almost on the same X-ray. You can see much more clearly the radial head, neck, the radial tuberosity, and the shaft of the ulna. You can see the olecranon fossa over here. This is the coronoid process over here, right? And you can see the wrist joint over here also. Scaphoid, lunate, tricuspid, pisiform, and rest of the bones. Okay. Okay. Now see here, see properly over here. So what will be this view of this X-ray?
Lateral.
Release joint.
It's a wrist, na? Arm, forearm.
Arm or forearm? Why
Forearm.
not arm?
Because in the middle position,
End of the humerus over here,
Yes,
but you
yes.
can see the upper end shaft
And
lower
lower.
end of the radius and ulna. You can't see the entire hand bones over here. So partly this is absolute, partly this part is absolute. The entire thing focused over here is nothing but the forearm.
Forearm.
So it's a plain X-ray,
lateral view of forearm.
over here. Okay. I'll show you something over here. See properly. Could you able to see any small blackish gap over here? This is the olecranon process and this is the shaft. You can see a small blackish gap. What might be that one?
Black.
And one more thing, see here, towards the lower end of the ulna, you can see one more gap. Okay, radius you can't appreciate, but the ulna you can see small gap over here, and this is the lower end of the ulna over here. What might be that gap? Epiphyseal plate, absolutely. So this is the entire shaft over here, and this one is upper epiphysis, this one is the lower epiphysis. And in between the upper epiphysis and the shaft, there is a small gap that is nothing but the epiphyseal plate made up of hyaline cartilage. Cartilage can't be seen, we have already earlier seen. Cartilage can't be seen on the X-rays over here. That's why it appears like a gap over here. So what might be the age of this patient over here?
Below 20.
Below 20.
Below 10 years, huh?
20.
Below 16 to 18 years like that. Roughly around 16 to 18 years like that.
Classification
The same when if you find any gap over here towards the upper end of the radius, that indicates again the epiphyseal plate over here. Okay. Okay. And you can see over here, you can see the age of the patient over here. What is age?
11 years.
years over here. Okay.
Oh.
If the age is not given over there, by this you can understand the patient is less than 20 years or 18 years or 16 years. Roughly. Okay. And you can see the skin over here, less, more greyish in color, and muscles over here, less greyish in color, and the bones are more whitish in color.
What is correct?
And there is no blackish color over here because there is no
No
air
AR.
in the upper limb, right? So this is a lateral view so that you can understand the radius is getting overlapped by the entire coronoid process of the ulna. Could you able to understand? This entire coronoid process is overlapping the head of the radius and of course partly the neck of the radius also. That's why it is lateral view. But here in this view you can see clearly the head of the radius and the upper end of the ulna side by side without any overlap. Based on this you can say this is the anteroposterior view
And this is
that
the lateral view.
Okay. And the next one, actually the both X-rays I have divided.